Because depending on what side of the argument you fall on, it can be hyper-combative. Which most people would be like, how can insurance be combative? Like, have you ever heard of insurance before? That's literally all it is.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Written by Dr. Deanne Rudden of Longmont Hearing and Tinnitus in Longmont, Colorado. The topic at hand is whether or not Medicare covers tinnitus treatments, and that's going to be a quick answer, but then we can get into other insurance coverages for audiology-related content.
Yeah, sure. We can use it a little bit like a springboard.
Perfect. So to ask and answer the first question, does Medicare foot the bill for tinnitus?
So as a general answer, Medicare will cover diagnostic services.
Okay.
Sometimes we have to look at medical necessity, so it needs to be referred by a physician. There are some new guidelines through Medicare where we can do audiological evaluations without, or at least one a year without a referral.
Sure.
But let's, bringing it back home to tinnitus specifically, there are some codes that are covered by Medicare for tinnitus evaluation.
Got it.
But in general, there is no coverage for any therapy options for an audiologist.
Got it. And so when we think of audiology in general, I think a lot of people get confused with what, if anything, is provided to them. And again, we know that your specific insurance plan is going to be vastly different than anybody else's across the country or even in your hometown. So this is hyper subjective, and it's just Dr. Michael providing some potential insights
Guidance
into a very complicated world.
It's wild.
Yeah.
Insurance is crazy. Insurance for audiology is even crazier. And the reason for that is because there's a diagnostic aspect, but there's also a retail aspect. I hesitate to call it a retail aspect. We're working with
a consumer aspect.
A consumer aspect. Yeah. We're working with medical devices, but many of the insurances are still qualifying those as cosmetic. And so it's not durable medical equipment like a cochlear implant would be. Cochlear implants and cochlear implantation, the actual surgical components of that, are covered by Medicare and Medicare supplementaries and private insurances. So you have to go to your individual plan to find out if there's any coverage for treatment. Yep. So in general, the coverage for treatment by an audiologist is very limited.
Sure.
Okay. They're working through this in the legislation, right? Because our scope of practice includes vestibular rehabilitation, oral rehabilitation, which is teaching people how to hear again, how to listen again, right? But even though it's within the scope of practice as defined by these insurance companies, there's no coverage for it. And so the general rule with Medicare is diagnostic components can be covered under many of those plans, especially just general Medicare, but any of the treatment options by an audiologist are not.
So what you're essentially saying is if you come in to get a diagnosis of what is happening with your hearing health, that may be covered.
Correct.
You're probably good. You're only going to have to put a copay on that bad boy. The treatment, which is typically a hearing aid, is more rare to see actual coverage from.
Yes, and so what we're seeing in the current market, right, or in the current world, is that Medicare supplementary plans sometimes will have some type of a hearing aid, what they call a hearing aid benefit, but oftentimes what it is a discount plan.
Got it.
So they will push those benefits out to a third party, right? And so it's a big hot topic in the world of audiology, third parties, whether or not we can take third parties, because mixing a third party into our typical patient mix is very, very difficult, because another name for third party is managed care. They tell us how we have to see our patients.
Right.
And sometimes we can work that into our current clinic flow, and sometimes it's so vastly different that it disrupts.
Right.
And it is a disruptor. It's advertised by insurance companies to the patient as like the best thing coming and going, but in reality, the patients are still paying out of pocket for the devices. It's a discount, so they get a little bit of a discount. They're discounted hearing aids and free services. Well, what happens is when you start mixing free services in to a practice that charges for their services, then what you end up is you get degraded services.
Right.
And that's not fair to the patient, and that's why the practice typically doesn't want to do that.
Yeah.
So we try to find options for those patients. Now, if this all sounds a little bit negative, but you need to call around and ask. So my charge to the patient, I will challenge every patient listening to this to do two things.
Listen up.
Yeah, listen. Call your insurance and find out what your understanding is of any benefits that are available for hearing aids.
Got it.
For treatment. Because there are some private, like Blue Cross Blue Shield plans or something like that have dollar amount benefits, which is actually a benefit. We as the audiology, as a company, can bill the insurance. They will pay for your hearing aids, and then you get the hearing aids, right? That is a benefit.
Yep.
When inside of a managed care plan, it's not necessarily a benefit. They're saying like, well, we will give you a discount. You pay a little bit less for the hearing aids. And now these are the services that are included.
Sure.
There may be services that are not included in there and you're still paying for them.
Yeah.
So whether it's a discount or not, who knows?
Right. And again, that what we're essentially saying is you got to do your homework.
Do your homework. I find that a lot of patients, including myself before this life of actually working with insurance companies, a lot of patients just don't understand their insurance. They think I pay a premium, they should cover it.
Yeah.
And they're often surprised. And so patients will call and ask questions and get upset, but they didn't do their due diligence in understanding, have you met your deductible? Does your benefit kick in only after you've met your deductible? And you're $700 away from that. So now your bill is $700 higher than you thought it was going to be. I don't know. That's just an example.
Sure.
But yeah, do your due diligence. So call your insurance company. I said two things. Call your insurance and find out your understanding of what's available.
Yep.
Call your audiology company. Call your audiologist and ask them if they would be willing to do a benefits check for you. And if they can do that, then you want those two things to match. Because with these insurance companies, you can call 3 times, get 3 different answers.
Totally.
So you want to make sure that it's as consistent as possible.
And the good thing about entrusting your audiology provider is this is exclusively what they're doing. And chances are they have called on similar benefits before. So they might even have a heads up to what your rates are going to be, the coverage that you're going to be able to have, but they could just at least confirm it and are a little more expeditious in the process than you kind of maybe traversing in the dark, not really knowing what you're doing.
Correct.
And that's if everybody's competent and capable. And that's why we hope your audiologist is competent and capable to be able to answer those questions for you, because they are very real in this day and age.
Yeah.
And nobody should be in the dark when it comes to what they are paying for monthly.
Well, don't hesitate
and what they're due.
Don't hesitate to call your insurance multiple times.
Sure.
Because you may also get multiple answers.
Yeah.
And I have this conversation with patients all the time. Well, I thought my benefit was this. I called and they said it was that. And then I called back and they said it was this. And so I don't know what to do.
Got it.
So well, let us call a couple times and see if we can't really get down to the nitty gritty.
This was going to be a potential lightning rod of a topic, and I think you managed it masterfully.
Well, I appreciate that. Thanks.
Because depending on what side of the argument you fall on, it can be hyper-combative. Which most people would be like, how can insurance be combative? Like, have you ever heard of insurance before? That's literally all it is.
Well, I hate to say it, but a lot of times it falls back on the company or on the audiologist. It's like, well, you're all you care about is money. All you're trying to do is like, well, no, we have to have these devices covered. But here's the thing. A lot of the insurances require us to fit the devices before we can submit for payment.
Right.
And so now the company has paid for thousands of dollars worth of devices with the hope that we're going to get paid by the insurance company. Right. And so when it comes back and we have to pick up the phone and call the patient and go, hey, your insurance company balked on this, then we're the bad guys.
Totally.
And so we have to be really careful when we approach this topic with patients and with insurance companies, because guess what? The insurance company will throw me under the bus every day.
Yeah.
And so,
very easily too.
Yeah, absolutely. And just having an open and honest conversation with your audiologist and go like, hey, I think I have this benefit. I'm worried that I'm going to get stuck with a bill
big time
after this.
Yeah.
And just having that honest conversation and go like, I want to make sure that these things are in place before that happens. And I don't think any audiologist that I know would be like, too bad.
Yeah. No, it's a personal thing. Yeah, exactly.
And throw the dart.
I'm with you.
I don't think so.
To continue this conversation, please head on over to askanaudiologist.com for all your hear care inquiries. We'll see you guys next week.
Toodles.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.